Those three might not be around so much now, but there are still people telling you the shots are still being injected into people. So this hasn't kind of stopped yet.
No, it hasn't. And I know that outside Gisborne Hospital in particular, there's still a sign saying it's safe and effective for pregnant women to receive, when
Hmm.
the data coming out internationally suggests otherwise. So there needs to be some sort of informed consent. There needs to be balance brought into this. And what we're seeing is still that if you disagree with these vaccines, that you're wearing a tinfoil hat and you're a crazy conspiracy theorist. But well, actually, we're really just listening to genuine data here from people who aren't financially benefiting from this study.
I saw a video with Petrusas Harris and Nikki Turner actually promoting jabbing pregnant women.
Yeah, was that back in 2021?
Yeah, it was a
Yeah.
kind of like a multi hookup thing, and they were discussing it. And I've watched it, and they were urging pregnant women to take it, and they were saying it was safe. Again, I wonder if anyone had any problem with their pregnancy or anything like that as a result of that advice.
There was no data at the time on it. There were no studies on fertility. There were no studies done on pregnant women. And the ones that were, a lot of those pregnant women just disappeared out of the original Pfizer trial. So they couldn't actually have gone and said that. They had no data to be able to back up those statements, which further emphasizes the fact that how much were they being paid to say that? Were they being paid? I can't tell, but I do know that the information I found from the finances in that article is absolute. It's on the Pfizer website.
Well, even if you weren't being paid, common sense tells you that that's probably one of the most risky sales jobs you could ever do in your life.
Yes.
Forget about the money
Yeah.
and to
Yeah.
be confident in doing it.
To be confident in doing it and saying, well, MedSafe's approved it, well, that's very fine and dandy, but MedSafe doesn't have a duty of care to the New Zealand public, nor does the Ministry of Health, and that's been sent back in Official Information Act responses. So there doesn't seem to be any accountability for the statements that they're making.